As Chris mentioned, my name is Sam Tornadori, and I have the honor to serve as the DuPage County Board of Health President and also represent District 1 on the DuPage County Board. Thank you all for attending here today. First, I would like to thank the DuPage County Health Department for their exceptional leadership throughout the past year in leading the county through this unprecedented time, especially now with the ongoing work to vaccinate the residents of DuPage against COVID-19. The COVID-19 pandemic has had a devastating impact on our residents. Since March of 2020, there have been a total of 88,491 confirmed COVID-19 cases in DuPage County. Sadly, we have lost 1,324 of our residents to this deadly virus. We send our deepest sympathies to the families who are grieving the loss of a loved one due to COVID-19. We've also seen this virus disproportionately impact minority communities across Illinois, including here in DuPage County. The DuPage County Health Department is fully committed to our county's vaccination efforts and has developed a robust countywide COVID-19 vaccine network of over 240 healthcare providers to administer the COVID-19 vaccines. This vaccine network provides vaccinations to our residents through accessible, convenient, and trusted locations throughout the county. Until recently, our greatest obstacle in getting vaccines into the arms of our residents has been the severely limited supply of those vaccines. However, just last week, we received our largest COVID-19 vaccine allocation to date with 43,790 first vaccine doses. This week is the first week we have been able to meet all of the requests for vaccine from our robust network of vaccine providers. It appears we're on a stable trajectory with our vaccine allocations where we will have access to the vaccine we need to protect our community. This increase in supply is greatly welcomed as vaccine eligibility recently expanded to include everyone 16 years of age and older. With more vaccines now coming to DuPage, we know there are more vaccine appointments available through local vaccine providers and through the health department. If you haven't already, this is the time to go out and get vaccinated against COVID-19 to protect yourself, your family, and your community. This is our shot, DuPage. With that, I'd like to turn the podium over to DuPage County Chairman Dan Cronin. Dan.
Thank you, Sam. Please first allow me to introduce and recognize some of our elected officials who are here with us today. We are joined by Congressman Sean Casten. DuPage, where's Sean? There he is. Sean Casten represents the area and been a good advocate for us, and we really appreciate you participating today. DuPage County Recorder Kathleen Carrier, there she is. Hi, how are you? Our team at the county board. Can't get anything done here at the county without a team approach to getting things done. And we are, I'm delighted to introduce members Liz Chaplin. Where's Liz? There she is. Member Lynn LaPlante. Member Sheila Rutledge. Member Greg Schwarzy. Member Amy Chavez. And member Paula Deacon Garcia, who is a board member on the county board and a health board member as well. We also are joined by Dr. Lanny Wilson, who's on our health board. Hi, Doctor. How are you, my friend? Nice to see you. So thank you for joining us and participating. As chairman of the DuPage County Board, there is nothing more important to me than the health and safety of our residents. Certainly, COVID-19 has posed our generation's most significant threat to public health. Mindful of this terrible toll this virus has taken, and mindful of the enormous challenge it continues to pose today, I want to remind us all of the progress that we have made and to provide hope and optimism. Here in DuPage County, we have been so fortunate to work with the professionals at our DuPage County Health Department who have been gathering and interpreting data, helping us make the best decisions possible with the information available. DuPage County Health Department has been a leader in demonstrating the ability of local public health to quickly and effectively meet the evolving needs of residents during this pandemic. For example, we opened our own community-based testing site and tested almost 60,000 people. This winter, DuPage County opened its own community vaccination clinic here on the campus, and we've administered about 75,000 shots at this location alone. Our accomplishments are impressive, if I do say so myself. But we didn't make this progress by ourselves, alone. It is essential that today we recognize and acknowledge our partners from hospitals, healthcare systems, pharmacies, municipalities, and nonprofits who've been working tirelessly with us to ensure that everyone eligible has access to these life-saving vaccines. And together, we're doing a great job of getting shots in the arm. As of yesterday, more than 322,000 or 34% of DuPage County residents have been fully vaccinated against COVID-19. 88% of residents 65 years and older have been vaccinated with at least one dose. And of DuPage residents currently eligible for vaccine, over 60% have received at least one dose. As a matter of fact, DuPage County is at the head of the pack in the vaccination efforts. Based on our track record today, I announced that DuPage County has set a goal that we believe is most achievable, and we are determined to meet that goal, and that is to fully vaccinate at least 80% of our eligible residents by July 1. Well, I'm thrilled about it, and it's so good to see the end that is in sight. Based on our track record, I'll even go out on a limb a little bit further, if I may. If we can work together and get our vaccination rates as close to 100% as possible, we will be doing all we can as individuals and as a county to end this pandemic. This summer, we love summer. We want to enjoy summer. This summer, we have the chance to turn the tide and get DuPage County back to the normal that we all crave. It's there. It's right in front of us. So everyone here and everyone who's listening, this is our shot, DuPage, to save lives and get back to the people and the places we love. This is our shot to begin to hug friends and relatives and visit our favorite restaurants and museums and concerts and festivals. But we can only achieve this important goal by working together with our neighbors, friends, and coworkers. Today, I ask my fellow DuPage residents to join me. Take action and get your shot as we keep DuPage County healthy. If we work together, we can ensure that our county emerges from this pandemic as soon as possible, stronger and more resilient than ever. To help you get your shot, our friends at Advocate, Good Samaritan, and DuPage Medical Group, our partners, have expanded their satellite mass vaccination operations. They are determined to keep you as healthy as I am. Now, Dr. Don Hoshide, the Chief Medical Officer for DuPage Medical Group, is here to tell us more about these efforts. Dr. Hoshide.
Thank you, Chairman. And first of all, I'd like to thank Chairman for his enthusiasm and all the members of the DuPage County Health Department for their partnership and support that we received both through the pandemic and with the vaccine effort. We've prepared for this moment at the start of the pandemic. We knew we were going to be here eventually. And we were proud partners to partner with the County Health Department early on when we received the Pfizer vaccine to be able to store it in our ultra-cold facilities. We've invested significant technical infrastructure as we've gone through the phases of the vaccine to ensure that the people that are at the highest risk for hospitalization and mortality for COVID were prioritized early on. And with each phase, we've kept that as one of our tenets. We want to make sure that the most vulnerable in our society were vaccinated first. DMG will be one of 7 and is one of 7 mass vaccination sites in the county. And to reach the goal set forward by the chairman, what we are planning to do is to reach beyond our patients, and we're going to welcome healthcare professionals, individuals throughout the county who are not currently patients of DuPage Medical Group. We're going to extend our reach to all members of the county and offer them vaccination through our facility and welcome them so we can participate in the process. Our doctors and our staff strive to lead by example. Early on in phase 1A, we reached 2/3 of our clinicians and were vaccinated. And since then, the vast majority of our remaining staff have received vaccination either through our site or one of the regional sites for vaccination. We truly believe that this is the way and the path forward. To our residents, I would say that social distancing and masking and washing your hands is very important in terms of trying to reduce your exposure and your spread. But vaccination is the way to the end of the pandemic. We do know that vaccines work. They help your immune system fight the infection if you are exposed, and they can substantially reduce your risk of complications and mortality. My physician colleagues and I have visited and volunteered at our vaccine sites. And when you see people getting a vaccine and you see the tears of joy, it really is a touching experience. And these really are shots of hope. And they're a symbol, but not only to the patient, but I think to our community, that there is an end. And if we look at July 1st as being the next step, it seems like it's pretty close and a whole lot closer than it was 14 months ago. Well, it may feel to some that the mRNA vaccines were produced quickly. What I would explain is that there's been a lot of research going on for these for a long period of time. And the CDC has stringent criteria in both how they're produced, how they're administered, and also how they're monitored, so we can be sure that they are safe. When you see your healthcare providers be the first in line to get your vaccine, hopefully that expresses that we truly believe in what we're doing and that it is safe. This is our shot, DuPage County. We continue to lead the state in vaccination rates, and I think that we can serve a model in our citizens and show them the way forward to spending more time with their loved ones and to achieving whatever our new normal will be. It's our shot that the more people that are vaccinated against COVID-19, we can reach herd immunity or population immunity or community immunity so we can reduce hospitalizations and we can save lives. All COVID-19 vaccines currently available in the United States have been demonstrated to be highly effective in terms of reducing illness and saving lives from COVID-19. Daily, I talk with my colleagues and patients about the importance of vaccine, not only for the individual, but also for those that we come in contact with, especially those high-risk individuals who can potentially receive COVID from an asymptomatic individual and then be hospitalized and potentially die from it. So it's an individual responsibility, but we truly feel it's a societal responsibility that we continue to vaccinate as many people as possible. We've all experienced a lot of loss over the last 14 months. COVID-19 can cause serious health issues, life-threatening health issues, and no one knows how COVID-19 will affect them. You can be young and get sick, you can be old and get sick, and getting vaccinated will help prevent complications. It will prevent you from getting seriously ill, and it can help save lives. As far as our numbers at DuPage Medical Group, we're presently with vaccine supply now available. We've expanded to 1,200 to 1,500 vaccines per day. Our present capacity is about 10,000 per week. This weekend, we'll give our 80,000th vaccination, and our safety rate and tolerance rate has been exceptional. About 43,000 of our own patients are now fully vaccinated. I think one message of the people that are going to be vaccinated is when you get your final vaccine, you still need a few weeks to continue to distance and to mask and wash your hands, because it does take a while before you reach peak immunity, and you want to continue to be safe and achieve the full benefit of the vaccine. What I would offer is that if people are interested in getting their vaccine at the DuPage Medical Group, we would welcome you. Whether you're a current patient or a patient somewhere else, we want to get you vaccinated. And there are two routes to reach us. One is through our website at dupagemedicalgroup.com/vaccine. And the second is by making a simple phone call at 888-MY-DMG-DR. That's 888-MY-DMG-DR. We look forward to working with the county, appreciate everything that's been done by our leaders, and we look forward to July 1st to achieve the efforts we're all putting together. And with that, I'd like to next introduce Dr. Megan Corrigan. She's the Director of Pharmacy Services at Advocate Good Samaritan Hospital. Thank you.
Thank you, Chairman, and the DuPage County Health Department for your partnership and support. As mentioned, I'm Megan Corrigan, and I'm the Director of Pharmacy at Advocate Good Samaritan Hospital. Over the past year, I have served as the co-incident commander for our hospital's COVID-19 response, and since December, I have been leading our COVID vaccine clinic. Advocate Good Samaritan Hospital has been dedicated to the vaccination efforts since the beginning, as we know this is our way out of the pandemic. Advocate set up vaccination sites across Illinois and Wisconsin to vaccinate eligible individuals during each phase, first prioritizing our own healthcare team members on the front lines and then vaccinating our highest risk patients. As a system, we are proud to have administered over 600,000 vaccines, and 50,000 of those have been given at Good Samaritan Hospital in Downers Grove. Good Sam is one of the 7 mass vaccination sites in DuPage County. To reach the goal set by the chairman, we have expanded efforts to vaccinate anyone in the community, whether our patients or not. We encourage anyone who has not received the vaccine to get one and to get it soon. Do it for yourself, do it for your loved ones, and do it for your community. As a clinical pharmacist, I have paid close attention to the development of the vaccine and reviewed all of the clinical data available. I can say with confidence that these vaccines are safe and they work. We know that COVID is a deadly disease, and the risk of getting sick from COVID and complications far outweighs any risks of getting the vaccine. As an organization, we are especially focused on the fair and equitable distribution of the vaccine and gaining trust within the communities we know have been hardest hit by the pandemic. We've been using every avenue to help engage individuals around the importance of the vaccine. Advocate Aurora Health recently launched the Neighbor to Neighbor Vaccine Champion Program, which is a training program that provides education around the vaccine to address hesitancy in the community. The goal of the program is to help community members and their families make educated decisions about receiving the COVID-19 vaccine. Members of the DuPage County Equity and Access Response Team recently completed this training, and another session is set to take place soon right here in DuPage. Advocate Good Samaritan Hospital is also proud to have led the planning efforts around the expansion of the DuPage County Health's homebound vaccination program. This partnership between Good Samaritan Hospital, the County Health Department, and local EMS systems will help expand resources in bringing the vaccine to homebound individuals. The program was designed to meet the needs of those who may lack mobility and endure logistical challenges of making a trip to the vaccine clinic. Given the abundant supply of vaccine, Advocate Aurora Health is now offering vaccine to anyone 16 years and older, whether they're a patient of ours or not. Scheduling an appointment at the Good Samaritan Downers Grove Vaccine Clinic or any Advocate facility is simple. You can simply go to our LiveWell app, book online at aah.org/vaccine, or by calling our vaccine hotline. No code is needed for any of these options. At Good Samaritan, we're also offering walk-in appointments, which makes it easy and convenient for anyone in need of the vaccine. Next, I'd like to introduce Karen Ayala, Executive Director of the DuPage County Health Department.
Thank you, Dr. Corrigan. I want to personally thank our extraordinary healthcare partners, our health systems, our hospitals, our pharmacies throughout the community. In addition, our community leaders, our residents, and our elected officials, from the federal legislators who have stood with us since the very beginning, to our statewide representatives and advocates, to our county board members, as well as our municipal mayors. Everyone else who has tirelessly worked to protect our community over the last 67 weeks. I say thank you. The vaccination progress we have made as a county would not have been possible without all of your tireless work, support, and dedication. On behalf of the DuPage County Health Department, I'd especially like to thank Chairman Cronin, our county board, and Board of Health, as well as our residents for their continued support throughout our COVID-19 pandemic response. Today, we are incredibly grateful as well as hopeful that we are now seeing increasing supplies of this life-saving vaccine coming into our community. Recent findings shared by CDC indicate the mRNA COVID-19 vaccines are both highly and tremendously effective, much more effective than we could have ever imagined. Based on real-world data outside of the clinical trials, people over the age of 65 who were fully vaccinated were 94% less likely to be hospitalized with COVID-19 than people of the same age who were not vaccinated. This is incredibly encouraging and welcome news as we continue our efforts to vaccinate our communities in order to get to the end of this pandemic. In fact, our own data on DuPage County residents shows that only 0.2% of confirmed COVID-19 cases since vaccines became available in our community on December 15th of 2020 have occurred in individuals who were fully vaccinated against COVID-19. Additionally, we are finding these vaccines are incredibly protective against severe illness and death as well. Since that same benchmark, December 15th, less than 1% of hospitalized cases and COVID-related deaths in our community occurred in individuals who were fully vaccinated. These vaccines clearly work and work well. In DuPage County, we built our vaccination plan by creating an expansive network of vaccine providers. And this provider network has been administering vaccines as quickly and equitably as possible. We are very confident in our county's ability to achieve the goal of fully vaccinating at least 80% of eligible residents by July 1st because of the increase in supply and the distribution network that we have achieved. But now we really need your help. Vaccinating at least 80% of our population against COVID-19 will help us to both decrease the substantial level of transmission we are currently experiencing, and most importantly to all of us, it gets us much closer to the ultimate goal of reaching the level of population immunity we need to protect ourselves and move on from this pandemic. To achieve this, the DuPage County Health Department has identified and operationalized a number of additional strategies to continue vaccinating individuals within our county and beyond. First, we are currently assuring that our school districts are vaccinating students 16 years old and older. And while we're doing that, we're also preparing for the potential and inevitable expansion, we believe, of vaccine eligibility to 12 to 15-year-olds in the coming months. This is a high priority strategy right now as case activity has increased once again throughout DuPage County, and youth cases have contributed to that rise through social gatherings and activities associated with sporting events. But until everyone has the opportunity to be vaccinated, we must continue to take steps to prevent the transmission of COVID-19 in our community through face coverings, physical distancing, and hand washing. We are also coordinating with businesses to encourage the vaccination of their employees. The health department is working with various employers to set up vaccination clinics at their work sites and to coordinate vaccination appointments at our community vaccination clinic. In fact, today we are piloting with several of our local businesses, even as we sit here. Additionally, we are customizing strategies to promote vaccine confidence in all communities, especially our communities of color, which have been disproportionately impacted by this virus. Earlier this year, we formed the DuPage Health Equity and Access Response Team, or HEART, with community groups to better address the needs of our entire community during this pandemic, as well as to better understand some of the barriers and confidence issues associated with the vaccine. This team has made tremendous progress in helping us understand and identify some of the challenges that we face in improving vaccine confidence within these communities. Together, we aim to address these concerns and increase vaccine confidence among all of our residents. Now, with the support of this HEART group, we recently launched a COVID-19 Vaccine Champion campaign, in which we collaborated with community influencers to share accurate vaccine information with their community through PSAs. And you'll see some of our vaccine champions on the orange Ironman signs. These PSAs are designed to promote confidence in vaccines by sharing accurate information from recognizable and trusted community leaders in order to help further motivate our residents to go out and get vaccinated, to really help walk us to the end of this pandemic. We've also hosted and will continue to host interactive question and answer sessions with various community groups to make sure that residents have their vaccine-related concerns addressed by medical professionals. We're committed to making sure our residents have the best information available in order to help them make informed choices. Another important element is our efforts to get vaccine to our most vulnerable residents. As Dr. Corrigan mentioned, we have been working with home health providers, health systems, and pharmacies to expand access to vaccine for individuals who are homebound or cannot get to a vaccination site. Our own health department nurses have been vaccinating people at home over the past few weeks. And today we are expanding this effort by partnering with local fire EMS departments. I'd like to recognize the work of Dr. Valerie Phillips and Frank Kolsky at Advocate Good Samaritan Hospital for their leadership to develop this program. As I stand here now, the Lisle Woodridge Fire Protection District and the Naperville Fire Department are vaccinating people in their own homes to pilot this program, and we look forward to expanding with other departments soon. This partnership will allow us to vaccinate some of the people who need it most. We remain committed to ensuring vaccine is available to anyone who wants to be vaccinated. So far, as was mentioned, more than 445,000 DuPage County residents have received at least one dose of vaccine, and we are working to assure that all the roughly 739,000 residents who are currently eligible to be vaccinated have convenient access to this life-saving vaccine. Because we want to get everyone vaccinated as quickly and conveniently as possible, today I'd also like to announce that our COVID-19 community vaccination clinic, located just beyond this building at the DuPage County Fairgrounds, will begin offering walk-in vaccinations beginning this Monday, May 3rd. What that means is that anyone 16 years of age or older can be vaccinated at this site Monday through Saturday between 8:30 and 12 p.m. Individuals under the age of 18 will need to be accompanied by a parent or guardian. However, as our site continues to operate 6 days a week and has increased the capacity and throughput of vaccinations to more than 1,700 doses per day, we welcome the additional opportunity to serve our community. This is our shot, DuPage. Everyone who is currently eligible needs to do their part to get vaccinated as soon as they can. If you are 16 years or older and have not been vaccinated yet, please register for your vaccination in DuPage County through our website at dupagehealth.org/COVID-19 vaccine, or call us at 630-682-7400 if you need assistance, or show up at our fairgrounds clinic beginning on Monday, and we will make sure that you receive a vaccine. As the calendar flips to May and Mother's Day is on the minds of many, I'd like to encourage us to think of providing a more enduring gift to mom than just flowers or a gift that is perishable. But give all of our moms a peace of mind. Get vaccinated against COVID-19. The sooner we get vaccinated, the sooner we can put an end to this pandemic and get back to the people and places we love. Thank you so much for coming this morning. Thank you for your interest and your ongoing support. And now I'm happy to facilitate taking any questions that we may have from the media. Joan? Mm-hmm. I think there are a number of factors at play, and I think it has been because we have had a unified message. Primarily, it is because we've had a unified message amongst ourselves, whether it be all of the elected representatives, or if it's our healthcare system leaders. Or it has been a resounding message that, vaccines are safe, vaccines are effective, and vaccines are the way forward. Sir. A great question. And the question of waning interest in vaccination is one that has been something that we've really been planning for since vaccine became available. And during those early days and weeks, it was unimaginable, right? Because the demand for vaccine from our residents far outstripped our supply. What we're seeing right now, I don't know that I'd necessarily characterize it as waning interest, but we are seeing a decrease in the demand at our clinics and for registrations. I think what we're seeing is that people who were enthusiastically interested in getting vaccine have now received their vaccine. But there's a whole other segment of our population, and those are really the ones that we're speaking to right now, who may not be pro or con vaccine. They may not even have concerns about vaccine. They simply have not prioritized getting vaccinated yet. And so what we're wanting to do is to reach out to those individuals and say, please make this a priority in these upcoming weeks. We will make it as convenient as possible. We will make it as easy as possible. We will make it as quick as possible. If you go to our fairground site, you can get in and out of that site. And I'm assuming the same is true at all of our high performing vaccination sites. Within 30 minutes, start to finish, you can receive this life-saving vaccine. And the bulk of that time is spent in the 15-minute observation period. Again, we're coming to businesses, we're coming to workplaces, we're coming to community groups and other places. Please avail yourselves of these opportunities. Well, right. I don't know that we have data to really drill down very far at this point. What we have seen and what the chairman remarked on is that we've seen great uptake from our over 65-year-old population. I'm very pleased with that because they did bear the brunt of the mortality, the disease, the severe disease, and the morbidity or deaths in that population. So we are seeing great increase in that. I think the other populations are the people who may not have all day, every day to avail themselves of a shot. And so that's another reason why we're really working to expand access.
Aaron, I've spoken with several people who had their vaccines through our vaccination site, and invariably they say it's a great experience. Are you creating a culture of kindness there? How do you do that?
Well, I think it's a shared vision of public health to make sure that we not only provide the required service, which is the vaccine, but to do so in a respectful and an efficient manner. And I think we at the DuPage County Health Department really hold those principles very near to our service delivery, whether it be COVID-19 vaccine or mental health services or WIC services. So thank you. Mhm. We as an organization have not. However, we've been working with our mayors and managers, with our employers to really see how we can incentivize, how this can be incentivized. I think the other part of incentivizing behavior is at first, although we were very excited about the vaccine, we weren't sure how well it was going to work. And so I think the other way of incentivizing people is to provide the data that represents such a compelling picture that it is phenomenally effective. And not only for your own health, but for the health of our community. We need to do this. So we're working in a variety of ways to really generate some incentive or creates a sense of urgency. Absolutely, we are. Mhm. We are working with the Illinois Department of Public Health to make sure that whatever process that they may have developed or be developing, that we can link with that. In the meantime, again, we're simply encouraging people to hang on to their vaccine cards, make a copy of it, get one of them laminated, carry it with you. But no, we have not been looking specifically at vaccine passports at this time. Our focus is getting the vaccine into arms, and then we'll move into that. I think that the 16 to 64-year-old, and I understand that it's not a terribly discriminating factor, but those are the people that I think we need to get to. I think we've heard anecdotally, don't have data at this point to support this, but individuals who may not have been impacted in the same way that others were this last year, either through their own health concerns or loss of family members or scary situations with hospitalizations and disease, may be less willing. We've also heard some concerns, from individuals who are concerned about the development of the vaccine and question the science behind the mRNA development, which Dr. Hoshide spoke to. So I think it is primarily making sure that if people are reluctant to get a vaccine, that their reluctance is based on more than simply an inaccurate social media post or an inaccurate myth that is being propagated through, their friends and the community. So our efforts have primarily been focused on providing education, data, and support.
Karen, those people who already had the virus tested positive, maybe some of those feel like they don't need the vaccine. You have a straightforward answer to those.
I would love to invite Dr. Hoshide up to address that.
That's a significant understanding, but a fairly easy question to answer because we know from COVID infection, you get a certain immunity, but we know that the immunity you get from the vaccination is much more durable and much more longer lasting. So present CDC recommendations are that if you have COVID, once you've recovered, used to be a 90-day waiting period. Now, once you're recovered, you get your full vaccination because we know that you're going to get a longer lasting immunity. Those recommendations may evolve, but that's the standard recommendation. And the only other comment I would make is in our communities, I think we have vaccine uncertainty. I don't know that there's resistance. I think that there's uncertainty, and where you have younger people who feel there are less risk, they're going to need a little bit more information. And so if you look at the different communities, male versus female, Republican versus Democrat, different faith communities, different ethnic communities, they get their information different ways. And I think our job is to reach out. We know that scare tactics don't work. I think we have to provide access. We have to provide information. I think when you have 132 million vaccinations given in the United States now, there's a pretty good amount of data. And the recent studies show that the most trusted advisor outside the family is their healthcare professional. So I think it's incumbent on us to ask every patient with every contact. I do it every patient. I say, did you get your vaccine? And it often starts a dialogue and it plants a seed. And I think that that's where we need to do what we need to do in a quick fashion to get you to July 1st. But I think that that's what we're seeing in more of the vaccine uncertain population. And I think it is uncertainty. And sometimes it's a lack of information that that fits with their view of life and society.
Once again, thank you for coming. And we look forward to celebrating the achievement of our goal later this summer. Thank you so much.